Hello again and welcome back to our discussion about anti-aging. Dr. James Meschino is with us. He is a fellow with the Academy of Anti-Aging Research. Two of his books we have with us, the Wrinkle-Free Zone and the Meschino Optimal Living Program. And before we move on, Dr. Meschino, where can viewers get a copy of these books?
Well, these books were well circulated into bookstores, but there are very few copies left as it stands right now. So I would encourage the viewer actually to call our 800 number and either get one directly from the company or to find a bookstore where they could get it. So I can give you that 800 number.
Yes, go ahead.
It's 1-888-251-1010. And they could direct your viewers from there.
Now, something we started to talk about before the break, and that had to do with supplements. Now, you recommend supplements when it comes to a person's overall health as well as with the process of anti-aging. Can you go through that?
Well, the thing to keep in mind, 7 out of 10 North American adults take supplements, so it's not like some foreign idea now to take nutritional supplements. But there's a science behind it. Most people are just guessing what to take. You know, most medical doctors haven't really embraced supplementation, so they're not the authority on it. They don't really have a lot of training in most cases, not all cases. And not everybody sees a naturopath. And some chiropractors are well educated on it and some are not. And so people are saying, you know, what, do I go into a health food store? How can this clerk know what my needs are? And that's true. It requires a specific workup. So the supplements that you take need to be based on how old you are. Are you a man or a woman? What health conditions you have? Do you have any signs of clinical deficiencies? Are you taking certain medications? What problems run in your family, as I was discussing earlier? So that going to naturalhealthtest.com and filling out that questionnaire will help you specifically know what nutritional supplements are best suited for your specific situation. This way you don't waste your money buying things that are useless. There's a lot of useless supplements out there, or things that would be inappropriate for you to take that would be well suited for someone else.
Omega-3s, though, they've been touted, and I know that your book, you talk about some very interesting supplementations, basic ones. Can you recommend some of those?
Up to age.
The basic. Now, obviously, we need to get,
basic.
obviously, in your profession, you deal one-on-one with an individual, but are there basic ones that anybody can take?
Up to age 40. Unless you have a health condition or you're on a specific medication that would preclude you from doing the following. Most people would really benefit from a high-potency multiple vitamin that's enriched with extra antioxidants, 1,000 milligrams of vitamin C, 400 IUs of vitamin E, a B50 complex, 500 milligrams of extra calcium, all sort of in one caplet. And then another supplement that has the essential fatty acids that you're referring to, that's a combination of borage seed, flaxseed, and a high-yield fish oil to get the omega-3s and one of the omega-6s that's actually hard to get. Those two things up to age 40 are all that most people require, and that's the foundation program.
Now, you're going to be speaking, and I don't want to forget talking about this, on April 13th, 14th, and 15th. Tell us where, Dr. Meschino.
There's the Total Health Show that happens annually in Toronto at the Metro Convention Center. And on the Sunday afternoon, I'm speaking from 3 to 4, and the discussion is all about how do you determine what your nutritional supplement requirements are based on who you are. So I'll be going through this in a little more detail for those viewers who are a little bit confused about supplementation.
Unfortunately, sometimes the supplements don't get absorbed by the body. There's a reason for this, Dr. Meschino. What is it?
Well, certain supplements are fat soluble, like vitamin A and D and E and K and coenzyme Q10 and lycopene and lutein. These are fat-soluble vitamins. That means you have to have those with a meal. If you just have them on an empty stomach after you brush your teeth in the morning, you take your multivitamin and there's E and D and A in there, and you're taking coenzyme Q10 or lycopene, they're not getting absorbed into your body. They stay in your intestinal tract.
So you need to read the package, because a lot of these vitamins do say take with food.
Yeah, and it's not just because
it's harsh on the stomach.
Yeah, it's because
absorption.
in order it has to attach to a fat molecule to get transported into the bloodstream so it can circulate. And so many things are better absorbed with a meal than on their own. And so that becomes a very important consideration, that you read the directions on the bottle.
Well, Dr. Meschino, we're going to have to go for a break now, but I know that you talk about the importance of a good detox. We'll be talking about it after the break. Stay tuned.